Dayton. Callie Dayton. So that's a perfect example. She cut her teeth in an ICU that was mobile. That's where she learned. Like people walking around on ventilators, like the most important thing, they only sedate them to intubate them, and then it's get them off sedation. Teach them how to tolerate the endotracheal tube, so they're not coughing and gagging, and they're not, sedating them until they're like. I mean, that is the research has shown for 20 years. Yeah. A lot of it that Callie's mentor did, that's published and shows this should be the standard of care. This should be the standard of care. Mobile ICU, you're only sedating them when absolutely necessary and to intubate. That's it. The patient outcomes in mobile ICUs are freaking phenomenal. And then Callie had to go to another ICU to work that didn't do that. And she's like, are we going to get them up? She asked, are we going to get them up in a chair? Because that was the routine. You get your patients on the ventilator up in the chair. And they're like, what, are you crazy? Like, because the old standard of care, which should be abolished now, I know it takes time. And as she said, it takes time for nurses who've been doing it this way, and just like, because it's hard as a nurse to see somebody choking and gagging and whatever on an endotracheal tube. There is education that needs to be done. There is whatever, but we've known this for 20 years. Why is the education not being done? Why are these ICUs not being modified? And I listen to that podcast, and it's like, I've been a nurse for since 94? Like, I didn't know that. Why didn't I know that until 32 years? How do the math? What that is? How did I not know that? I was an ICU nurse.
Yeah.
Oh my gosh, 20 years this research has been out.
And here's the thing.
It was the first time I heard, and I would cast on innovations. Well, anyway, I'm sorry, I'm getting very passionate. Please, Wendy, continue.
I was going to say, but even if you then go see her at a conference and learn about this and get your continuing education credits, and you go back to work and you can't implement it.
You can't implement it. You can't do anything. And so in the research, nurses' attitudes, the research, the meta-analyses about nursing attitudes and satisfaction with continuing nursing education, it's all over. The frustration that we're not involved. Why are nurses not involved in making these innovations? We just like the moral injury of learning something new that is true, and then having to go back to an ICU or your clinical setting, whatever it is, and not being able to do anything about it, and seeing the same things being done for the last 20, because it takes so long for that information. Like, what do we do? Like, folks, this is ridiculous. You say your hospital, and I'm sure it's in every hospital mission statement about patient safety and patient outcomes and all that stuff. Well, what are you doing? How about we get some nurses involved?
And on that note.